everybody, welcome to my channel. Today we're going to talk about bipolar disorder. I'm Rita and today it's all about you. Bipolar disorder, or formerly called as maniac depressive disorder or maniac depressive illness, is a condition that affects our moods, which swing from one extreme to the other. That extreme swings include emotional highs that are mania or hypomania, and emotional lows that are depression. When a person is in the depressed phase, they feel the typical depressed symptoms like feeling sad, hopeless, or a growth in the irritability all the time, lacking of energy or difficulty in concentration or even in remember things, loss of interest in the daily life activities or in the activities that usually give them pleasure, feelings of emptiness, worthless, despair, guilt, pessimism, self-doubt, disillusion, lack of logic or even hallucinations, lack of appetite and a change in the pattern sleep, and of course suicidal thoughts. When the mood shifts to the maniac or the hypomania phase, the symptoms usually are feeling happy, feeling overjoyed, talking extremely fast, feeling full of energy, being easily distracted, irritated, agitated, and delusional. There are a lack of appetite and a lack of need to sleep, doing things with disastrous consequences, making decisions or do things that eventually may be harmful for themselves or eventually to others. And all of these mood swings can affect the whole daily life, like sleep, eat, activity judgment, behavior, and the ability to think clearly. Some people can have these mood swings more often than others, and some people can have in one of these stages longer than others. For some people it can happen multiple times a year, or can even happen only once or twice a year. But it's also very common to have some emotional symptoms between episodes. It is very common that bipolar disease runs in the family, and studies show that people with certain genes are much more likely to develop bipolar disorder symptoms, but there is not a cause for that to happen, so it is not proved that this can happen. There are three types of bipolar, and the first one is the bipolar 1, defined at least by one maniac episode and a depression or a major depression before or after this episode, and this is very common in women and men. The second type is the bipolar 2, which is defined by one major depressive episode that lasts a minimum 2 weeks, and then one mania or hypomania episode that lasts at least 4 days, and this is usually only happens in women. The third type is cyclothymia, which is defined by short episodes of depression and short episodes of hypomania, much less severe than the other two types, and between these episodes the mood usually is stable. Usually a bipolar diagnosis is started with a physical exam that includes medical history, medical tests that rule out other conditions, and a mental evaluation made by a mental health specialist. The treatments for this disorder usually helps people with most of the symptoms, experiencing a much stable mood and a much stable life in general. The treatment usually involves medicine to help balance the chemicals on the brain, psychotherapy that helps with emotions, thoughts, behaviors, and teach how to cope with the mood swings, or other kind of treatments that they are starting to be very common, like electroconvulsive therapy, getting regular physical activities, and eventually keep a chart where a patient can tell all the things that happened during treatment, recording symptoms, emotions, sleep patterns, life events, and any other thing that can eventually trigger crisis. As most of any other mental health disease or disorder, bipolar is a chemical imbalance on the brain, and this is extremely complex because it is not the same for everybody. So each person and each organism and each brain can have this disease in different ways or different nuances. But with a healthy lifestyle and the correct treatment, it is possible to have a stable, functional life again. And so that's all for today, guys. I hope you like it. I hope you subscribe to the channel, leave a thumbs up, share with a friend, comment if you want, and I'll see you next time for another video. Bye!